Many students in our schools are diagnosed with attention deficit hyperactivity disorder. It is one of the most commonly diagnosed disorders throughout North America. An individual with ADHD consistently displays one or more behaviors that fall into the categories of inattention, hyperactivity, and impulsivity, significantly more often than other students. ADHD can hinder ability to self-regulate activity levels, lead to impulsiveness, and cause inattention, which can negatively affect work ethic in school and social relationships. Children diagnosed with ADHD are often treated through medication and/or psychological therapy. According to researchers Garasco-Moore, DePaul, and White, only about 50% of students with ADHD receive some form of special education programming in the United States, with 80% of these students being placed in general education classrooms. Having the majority of students with ADHD being placed in general education classrooms, it is important that teachers are made aware of strategies for providing guidance and support for these children and adolescents. Many studies have been conducted on teaching children with ADHD self-management strategies that have positively affected their school performance. Self-management is a self-regulation process in which consists of methods for self-assessment and recording of academic performance and behaviors. It can also be referred to as self-monitoring. A benefit in training students with ADHD in self-management is that it teaches the student responsibility and advocacy for his or her own academic success and actions. Self-management can allow the student to feel in control of their success. Self-management was taught in Garasco-Moore, DePaul, and White's study of 3 12-year-old students with ADHD having trouble arriving to class prepared with the right materials, completing homework, and working on in-class tasks. The students had the concept of self-management explained to them, and they were given a behavior plan, a student log, and a checklist for self-monitoring while in class. Each student had to identify the problems they had been having, in which went into the development of their plans and checklists. The participants also practiced goal setting with the trainers regarding preparation and behavior improvement and had to indicate these behaviors on their checklists. They also had to mark down times they self-monitored on their checklists. Over time, students, trainers, and teachers documented a significant increase in target behaviors of preparedness, in-class, and homework completion. In a study of younger children and self-management by Jahedi et al., 40 children in Iran of the ages 5 to 6 with ADHD were given self-monitoring worksheets. Each time they spoke with permission, refrained from moving from their seats, and practiced taking turns during playtime, they were instructed to check off a star on their self-recording sheets. If they did not comply with those target behaviors, they were instructed to cross out a star. Teachers were also given papers to make reports on the behavior of the children. Jahedi et al. Found that self-monitoring in the form of helping to increase desired behavior was effective, as adverse behaviors decreased significantly in the experimental group compared to a control group who did not receive self-monitoring instruction. Considering this study was performed on young children, it is primarily about controlling behavior that is associated with ADHD and does not focus on attention while performing independent schoolwork. On the contrary, the study demonstrated that there has been success in teaching children as young as senior kindergarten self-management skills. An additional strategy for teaching self-management was used previously by Harris et al. They helped middle school-aged children diagnosed with ADHD with their attention and focus. The researchers trained the students to record if they were on or off task at the sound of a beep during language periods when spelling was being taught. The random intervals of beeping sounds made it impossible for the students to predict when they had to be on task, which maximized their effort to stay on task throughout the target lessons. To assess academic performance, students had to monitor and record the number of times they practiced spelling words, then after the test, record the number of correct spelling words. This step helped the students understand the connection between effort and success through their recordings and teacher conferencing. A program such as this one by Harris et al. Could be modified to fit the needs in certain subject areas of other children. Research has shown that self-management is a strategy that benefits students' ability to take on an active role towards their success academically and behaviorally. Self-management involves conferencing with each student, developing goals and programs consisting of checklists, timelines, checking on and reinforcing progress. Teachers can even take self-management programs a step further by having the students graph the occurrence of specific behaviors. Self-management is often linked with self-reinforcing, where the student can provide him or herself with the reinforcement. Self-management is individualized, works on a case-to-case basis, and thus would benefit many students with ADHD in general classroom settings. The Ministry of Education British Columbia website also contains useful information on managing ADHD in a general education setting. Using checklists and agendas are great tools for self-management, but also the establishment of classroom routines, lists of study skills, and chunking assignments are all helpful strategies that benefit students with ADHD. Dr. Rosemary Tannock, who has the position as Research Chair in Special Education and Adaptive Technology at OISE, states in a research monograph that students with ADHD benefit from an inclusive educational model where teachers use the latest teaching strategies for students with a learning disability. She states that students with ADHD strive when there is a reduced cognitive load of academic tasks to avoid working memory overload and the use of modified instruction. Ultimately, teaching self-management would benefit a student with ADHD as part of their modified instruction program. Thank you for listening to my presentation.